As we know, nurses are very busy, especially when they're on inpatient units. They have plenty of patients that they have to take care of, and they're not always able to be in the rooms 24/7. As virtual care coordinators, we are keeping an eye on the patient 24/7. We can alert the nurse if there's a change in the patient's status, maybe acuity change. If the patient is not capable of using a call bell, maybe because of their mental state or whatever ailment that they're experiencing, we can be able to be the ones to call the nurses or the staff on the floor for them.
Definitely, I believe we are third eye for the nurses. We actually are a helping hand to them. We notify them when the patients are endangered, as in fall risk, as in abuse from family members. We've stopped substance abuse, people who snuck in drugs. So definitely, I feel like we're a third eye for the nurses.
There are some moments that patients do need someone to keep an eye on them to make sure that they're remaining safe while they're by themselves in their room. This is where the virtual staff comes in. We're able to monitor the patients around the clock. We can see things at times that the nurses aren't always able to see because they're not always available to be at the bedside. It makes me feel good knowing that I'm there to be able to lend a helping hand to make sure that someone's loved ones are safe within the hospital, especially when they can't be there to watch over them.
Over time, I can see that the quality of everything is getting improved. We have additional hospitals that are also being input as well. And we also have more staffing since it's like basically as a whole, we're growing. It's also just something that everyone's kind of learning. So we're kind of like helping each other learn the whole process of how to do everything. But I've seen the improvements of it over time. I feel like with the cameras, with the Vocera, this all like comes into play.
We started off with one hospital, and then now we have about 6 hospitals, more patients. I started with just 4 patients on computers, so it was about 5 staff, and we had 4 patients on the monitor, and we're just like, okay, waiting for something, but now we have 45. Some days it's 36 because at the end of the day, some people go home, some people go to rehab, they're discharged to different facilities, but the numbers are growing. More hospitals are aware of what we do and they're coming on board, as well as I know for a fact the nurses are happy because now they get to put their patients with us and they have a sense that, you know, nothing will go wrong because we're watching.
I feel like I have great team members. I feel like the communication is very well. We all get along. We don't come here and be like, oh my God, we're here at work. It's like a very welcoming environment ever since I've been here. Supervisors and managers are very welcoming. They're very nice. If you need someone to talk to, they're always available and they're always there to give you a helping hand with anything that you need.
Here within the virtual care department, we have a great team of staff who are always willing to help, whether it's to help the nursing team or the medical staff at the hospitals, or it's to help each other. We have each other's back, and we have great management too who can be very flexible with us, especially when things might come up at moment's notice. As long as we work with them, they'll definitely be willing to work with us, and it makes me very happy knowing that while I'm here too, because this feels like it's more than just a job. I'm able to come here and still have that work-life balance that everybody wants, so it's good.
I love working with the VPO team. They are very professional, lovely people. We help each other. We are like a family.
So the main skills that you need to succeed in this work environment is to be a team player, to know how to interact with staff, whether it's your staff on your unit or the staff in the hospital, know how to call the nurses and use technology to speak to the patients in the room, and to call the nurses on Vocera, or even to use Epic to send messages to doctors or providers.
You have to have an eye. You have to be able to catch the little things that, you know, some people might easily mistake. And then on top of it, you have to have a passion for it. It's not just sitting behind a camera and I'm watching people sleep or watching people talk to whoever, family members or staff. But you just have to keep in mind that you're there to help and to look for things that might be harmful to the patient, to the staff. You have to keep in mind that this is not just a job behind the monitor. You're considered a staff yourself, and you're definitely important. Your role is important.
Well, if you have a background in healthcare or social services, if anything, because even with social services, you have to be able to pinpoint changes and pinpoint behavioral changes, with our staff, we have to check for these kind of things. And if you come from a background in healthcare where you were either a nurse or going to school to become a nurse, this would be great for you too.
If you want to join Mount Sinai, I say go for it. It's a very good team. I promise you probably will like it. There's a lot of opportunities to grow, and I think you won't regret it.